Welcome back to Good Day Orlando. On the Health Watch this morning, a potential breakthrough in the fight against cancer. Doctors in one North Carolina hospital using cutting-edge technology to target and destroy tumors considered inoperable in some patients. They're developing a 3D image guidance system to help doctors target just the tumors and nothing else. Researchers say it will decrease time in the operating room and lower complication rates. This is just one of the ways doctors are working to fight the battle against cancer. Others are using minimally invasive procedures to remove brain tumors in children. The news station's Bob Pryor has more in today's Healthy Living House Calls, sponsored by Advent Health.
The word brain surgery, well, that's scary, obviously, to hear, especially if we're talking about your child. Well, that's why in this morning's Healthy Living House Calls segment, sponsored by Advent Health, we are talking about going the minimally invasive route. Joining us now is Dr. Kaveh Asadi, a pediatric neurosurgeon at Advent Health for Children. Good to see you, sir.
Yeah, good morning.
So, is this common? Because you don't think about brain surgery. I guess I don't think about brain surgery with kids, but it's common.
It's a lot more common than what you would expect. Brain tumors in kids are actually the second most common childhood cancer.
No kidding.
After leukemia. And looking at certain age groups like infants and 5 to 19-year-olds, brain tumors are actually the most common.
So when you're saying minimally invasive, are we talking about on the lining so you don't go into the brain, or can you actually go deep into the brain and still be minimally invasive?
It's so minimally invasive surgery is we can go as deep as to the center of the brain.
So you get a tumor right out of the middle of the brain?
It's, yeah.
And how is it minimally invasive? How do you know?
And so the difference between minimally invasive and the traditional way we do surgery is that minimally invasive, we can access tumors, for instance, through the nose or through much smaller incisions and remove a tumor through that route.
You can reach the brain going up through someone's nose?
Yeah, that is correct. So for that we use the natural passages of the nose and then the nasal sinuses, and after removing a layer of bone, the brain, and the tumor is immediately on the other side.
So you wouldn't have, so you don't have that giant scar on someone's head. You don't have to remove the skull. There's just a little bit of bone back here in your nose somewhere behind
right,
there,
in the back.
Sinuses.
That is correct. Yeah, there will be no incision, and that's a technique which we offer at Advent Health, and it has to be tailored to the needs of a child. So not every child would is a candidate, but even compared to traditional surgery, we can apply more minimally invasive techniques where the scar is smaller, when we cannot access a tumor through the nose, and remove a tumor through that route.
Well, I would, forgetting about the aesthetics, which for a child, obviously would still be an important consideration, I would imagine the recovery time would be faster too.
For sure, the recovery time is faster. One of the biggest reasons for that is we don't have to manipulate the normal brain. Usually during traditional surgery, we have to pull the brain apart in order to remove a tumor, which those things are minimal to non-existent during minimally invasive surgery, and which helps with recovery time and fewer side effects.
That's amazing, amazing. I'm sure you probably have a lot more other questions about that. Dr. Asadi, we appreciate you being here with us. If you'd like some more information about this, and we've got a whole bunch of other health topics going on, all you got to do is visit the fox35orlando.com tab and then click on the House Calls tab. Dr. Asadi, thank you so much.
Thank you.